for having me today. I want to present today slightly different from one of my previous presentations that I might have had with this group also, which really focused more about my art. But today, I really want to focus on just engagement tactics for tribal communities, especially Pueblo, like Acoma and Zuni. This particular research group is working closely with those communities. So being that I am from Zuni Pueblo, I really wanted to kind of showcase engagement and best practices when it comes to both community engagement. And for those of you who might be doing, surveys or consenting with individuals, there's also that individual level of engagement, kind of more on that clinical end of things. So, and this is just kind of gathered together from my experiences growing up, raised, I like to say, traditionally as modernly possible. There's a lot from home that we are sadly losing, but those that we've kept, I've been really, instilled in these traditions. My first language was Zuni. I've been out here in Albuquerque for 20 years, and not knowing that my artist background was going to one day get me in some doors that I thought I had to go to medical school for. I mean, I really still wanted to focus on, one day, becoming a clinician, but research has really become something that I've been really interested in because I'm seeing actual work happening. I'm seeing the effects and seeing, how we're engaging communities, historical traumas that exist in tribal communities, especially with research, especially with biomedical research. If you know about the Havasupai incident and the misuse of the data that occurred there, our people remember that and our people know that. And they think about that every time a research group, medical group, any kind of academia or outside entities come to inquire, ask about our communities. And so here in New Mexico, you all might know this already with the 23 tribes and the 19 pueblos, there's 7 languages spoken. So when, in the clinic or in research centers, we talk about, translation and interpretation. This makes it really difficult for us, for those of us from these indigenous communities, because unlike other languages, we cannot simply translate health or scientific information word for word, verbatim. There has to be more translation of the actual material. It kind of takes somebody to be a physician, be a provider, be a researcher to be able to actually explain these complex topics to community. So of the 7 languages, only a bit of them are written, or recently have been written. Languages like Toa are not, and so it's really hard to work with community to develop things around language, and it's more oral. And so when we talk about the communities that we work with, the idea of tribal sovereignty is to, know that these tribal governments are sovereign nations and they have a legal authority to regulate and of all activities on their land, whether it's with the people or the landscape. However, not all tribal governments are the same, as I'll show here. Just as a kind of a quick overview of what some of the tribal councils look like that we have to engage in some of our research centers. So, whoops, it's a little cut off, but we engage primarily with Navajo Nation and Laguna Pueblo, and I added Acoma and Zuni for reference here as well, just to show the differences in communities and tribal organizations and how they work. And when we want to begin research of any kind, of course, we have to engage the tribal council. With Navajo Nation, there are up to 110 chapters. So in order to truly engage these communities, you start at that chapter level, you make your way up to the executive level, and the president and vice president. But there's also chapter officers. There's so many ways that it's broken down. Navajo Nation is a large enough tribe to have their own IRB. They also have their own EPA. And so that's how we engage them, is through their Navajo EPA as well for our environmental studies. Folks, the difference in Laguna is it's a Spanish form of government, as with all the other pueblos. They have the executive and legislative branches where we actually, for our meetings, we meet with people from either the council reps and or through ENRD, which they're the Environmental or Natural Resource Department. And we also have to meet with all leaders from each village. There's 6 villages in Laguna, so they also have their own leadership within their respective villages. And the way we engage community is that we have to go through the process by talking with the town criers, the village mayordomos, and all the representatives to get to that community level, to have their audience and to have listening sessions. Collect your information and then leave us. And what are we to do? And so to think about how we train some of the community members to continue the work, or to find further funding to continue to stay in these communities and answer further community concerns and questions. And so again, all this data, all your research work is being used to inform tribal government for lobbying for change. Now I kind of want to go the other direction. I talked mainly about community research, but how about at that individual level when we do like research trials, genetic testing? I'm also part of the UNM Cancer Center, and we are running the one and only first ever cancer genome sequencing in indigenous people. We are partnering with all 23 tribes in New Mexico, primarily the 19 Pueblos. Genetics is a really hard thing to talk to them about. And so we're only recruiting through UNM Cancer Center. And we've had several of our providers be very unsure of themselves or very uncomfortable to even bring this up with individual patients, individual cancer patients and their families. And so a group of us put together a provider tip sheet, and we talk about how one must be patient and understanding of an individual's right to sit and basically, you can say, marinate on the idea of joining a research trial, a research study. And so we have several recommendations. First one is to understand these historical traumas that I talked about, to understand the journey that these communities have gone and that they're still healing from, and to know that people will push back or be offended or triggered by certain information being relayed to them. And so I'm a big supporter of going through training on trauma communication, trauma-informed communication, so that you know and you are aware what can and what might trigger communities like this. Of course, I mentioned this several times, but the next one is to listen. Provide that culturally respectful place. Don't be judgmental, listen. If your point of view, if your way of life is different from theirs, honor and respect that they come from thousands of years of culture and history, and that some information they share with you, they need that space to know they can share that with you. And most times, patients bring family, indigenous patients. It's very rare that they're alone. Decision-making happens not just at the individual level. A lot of people will say, let me talk to my family about this, let me talk to my kids, let me talk to my husband, my parents. So it's like a collective decision sometimes. So we have to give them that space and listen to family members that are also present in the clinic. Again, allow for that time and space to ask these questions. If you're asking them to consent to a trial or be a part of a study, give them that time to think about it. Do not hover for an immediate question. Come back when they're ready. This helps build that trust and that relationship that you're willing to give them, that respect. Offer visual aids or translators. Again, I mentioned before, toning down the jargon, bringing down the literacy level to about 7th grade, 6th grade, 7th grade for a lot of the communities here. And if you sense that discomfort or they're not understanding what you're talking about, it's safe to ask for a translator. And UNM is really nice to have several kinds of translators here. Very recently, Zuni translators were in the news and interpreters, so I'm pretty happy for them that they've gotten UNMH to support that. Also, recognize the idea that, again, the wholeness of the individual is everything around them: community, environment, spirituality. There's so much more that goes into what well-being means. It's about, not only physical, but mental, emotional, spiritual, and everything is connected, everything is balanced, even, the trees outside. And so that's why it's very sensitive when individuals are asked to give up specimens and to find ways in which these specimens are analyzed and kept and stored is something to also really think about. Most of our centers at CEHP, we return samples. We give them that option of time of consent, saying if you want your blood back when your study's finished, we will return this in the best culturally respectable way that you ask for. And so that's been a really neat thing. It was a push on our side for our grant funders to allow, because science is science, but Indigenous people's voices are being heard. And so we've been allowing even certain specimens not to be collected, like semen or umbilical cords, dry umbilical cords, shed teeth, all things, umbilical cords and shed teeth were, we give them back to the earth ceremonially. We don't just throw it in the trash or, wear it around our necks or, put it in a scrapbook. We return these things back to the earth because one day we all return back to the earth, and this is our umbilical connection to Mother Earth. And so some of these specimen collections are too sensitive, and we've made those exceptions. And next is empowering your individual, your family that you're working with. Give them all the knowledge that they ask for about your research. Be clear, be transparent, what their specimen, what their data, what their information, down to the surveys. Tell them what it'll be used for. That should all be, of course, it won't pass the IRB without you putting down how that will be protected and safe, but you also need to relay that to the people you're working with, the individuals and the families. What exactly will their data be used for? And also, just to honor, and this is a big thing, very recently in the news, Medicaid, Medicare will now pay for traditional healing in NIEHS systems. So we kind of wrote this about a year ago, so we had to remind people, honor if they decide to practice traditional healing practices and not be judgmental, and most practices will not deter to being a part of a research study. And so one of the biggest questions we have from communities sometimes, especially with genetics, especially with data that will be used kind of in an aggregate form, is will this data be used to prove the migration routes of our people, which unfortunately anthropology still keeps doing. But we have a lot of questions. Sometimes in genetics research, some of the community members will ask us, will this affect my tribal enrollment? You know, will this, you know, how does this affect my status, my certificate of Indian blood? They truly have these questions. And sometimes we get off the wall questions. It's like, well, when you take my blood, are you going to clone me? You know, that's a real worry. It's real. It's a real worry from these communities. And so we have to, you know, be patient and honest with, you know, how science works, and by empowering them with this knowledge, they get that better understanding and have that informed consent to participate. But yeah, that was pretty much the end of my presentation. I really thought that this was something important that I should share that is kind of separate from my artwork, but you know, it still aligns with how we engage community, you know, best practices, and how we can all benefit from one another, and we are doing just collaborations, collaborating with integrity to these communities, because there's a lot going on in our tribes, and we need answers, and we need, you know, ways in which the communities can start pitching in as well and be a part of this. And hopefully we're recruiting from these communities you're working at and opening doors for the younger generations. So thank you. I'll take questions.
Earlier about creating space. Is that creating a space to meet with people, which is actually the physical space, or are you creating space for digestion of the material you're given? Mental space?
Yeah, both. Giving the mental space, being non-judgmental, not, you know, really cognizant of not, you know, being dismissive, I want to say, of belief systems. Because especially when you start building these relationships with Native peoples, they'll share a lot with you. We love to talk. We love to tell you stories. We'll tell you our whole life story in one sitting. But to give them that space to let them do that, they'll come back. They'll spread the good word that you were kind to them. But also making these empty white walls a little prettier with things like that, and with imagery and safety. I use a lot of symbolism like hummingbirds, dragonflies, flowers, turquoise. Here in the Southwest, those are all healing and protective elements. And so having that around builds like kind of this spiritual safetyness. Like what goes on here. I know that images like this are here, they're representative of us. We know that we can share, you know, and have that trusting partnership.
I was just thinking about that, like if we were meeting with an architect and talking about designing space like for exams or for debriefs, like beyond the art, like would there be additional things that would help or facilitate that?
Yeah, I mean, I think, you know, just like kind of like the ideas of feng shui, you know, the way that the places are set up and set about. We've been constantly, you know, our communities are critical of us, and we listen and we remember, but our community despises coming to UNM. It is so hard to park. It is so hard to find these rooms. Like even walking in, I didn't know where I was going. I'm like, it's way back here somewhere. If you're bringing community, that's like a no-go. And so we've had people tell us that the inaccessibility of UNM, like, because we want to involve, we want to have community panels. A lot of the times, yeah, we have to really be considerate of when we bring community in and have it more inviting, more warm, less intimidating, less, you know, there's been some changes happening around campus that I really like, that people are taking initiative to be more welcoming, putting, you know, flowers, putting coloring books, putting, you know, different things in waiting rooms and in meeting rooms, and just being open to things like that, allowing more light, see the outside, see, you know, different things like that. I'm pretty sure there's people who are experts in how to create a more
Yeah.
lively place. And those are the kinds of places you want to bring patients and community into.
Thank you so much. That was a really wonderful talk. You covered so many things that are really important for our center. And one of the things that I am really hoping that we can learn more about, and I know you work with Laura and Jessica, so you've probably had a lot of these conversations already, but for the broader audience, what are the best recommendations you have on how do we get more leaders from the community, people from the community engaged in doing the research? And kind of, I think we want to try and, the next phase, foster the growth of people leading the research. You know, we're kind of like supposed to be a support network supporting the next generation of people who will be doing this research. So I'm curious if you have any thoughts on that.
Yeah, I mean, I think the most important thing that some of our centers are not doing enough is engaging younger people before college. So we have direct access across Lomas to undergrads, but we also should be accessing and engaging high schoolers, middle schoolers, building more, you could say, pathways to these positions, to these centers. I mean, when I started at UNM, I went through blindly. I didn't know who to reach out to. I didn't know if there were internships. I took internships outside of UNM because they promoted it and advertised it so much more than UNM ever did, for me at least. And so building, you know, like UPN has their pipeline, if we could be more, you know, cognizant of what your center is doing, especially if you're working with tribal communities. Let's say, you know, like here, like you're working with Acoma, you're working with Zuni. Reach out to Zuni High School. Reach out to LA, the Laguna Alamo High Schools. Reach out to their education departments. Reach out to their higher education departments. They all have them, and they can connect you with undergrads here too. American Indian Student Services on South Campus will be happy to connect you with students who might have this interest in research or engagement, or even artists. They have all these resources down there, but the biggest one, when you work directly with tribal leadership, maybe there's a delegate that will be assigned to your program, or a community liaison. They know the workings of their community. They will point people in your direction. You will find these people for you. And, you know, again, I said, make sure your grants have that space to bring them in, because it's really crucial. And when they become part of it, the community is really uplifted by seeing their own doing this research. I know we have, in some clinical studies, we have the CHRs doing a lot of the work, but how are we elevating the CHRs as well? Are we doing training? Are we offering them, you know, upper level, you know, possible positions elsewhere? Are we, I mean, not to take them away from the community, but giving them more.
We had a recent conversation with Dr. Tassie Parker, and she said something that really stuck with me, but I wanted to know more about the solution. And she said, you're a guest in a foreign land, you're gonna mess up, and it's not as much, fix me if I got this wrong, it's not as much about the mess up, it's how you handle it. But I think that's what I would love more guidance about, either here in the future. Is like, how do do your best prep to make sure that, you know, you are honoring traditions and are, you know, being respectful, but, you know, how do you not mess up the mess up?
Or not keep messing up.
Yeah.
Yeah. I mean, accountability is the one thing. I think everybody appreciates that. If someone made a mistake, you own up to it. You present the changes that will be made. It is, you know, the decision making in these communities, although we do close up when things like that happen, but having that clear communication, you know, not just apologizing, but, you know, coming forth with these solutions, they'll help you develop the next step. I mean, we've basically have gone through that. And yes, a lot of, phone calls had to be made and the right people had to be contacted to, so to say, do some damage control. But that's where, when you hire these community liaisons or the people that will be connected to your groups, that they're the movers and the shakers of the community that know how that works, that process works. Because before you even make the mistake, they'll already call you out on it. And you need to listen. They will tell you, and you need to find those kinds of people to work for you. Like I was telling people that I'm like running around, I said, it's because I have a big mouth. I won't just sit there and listen to something that goes against, of course, better judgment, but against my community. Tamara has heard me say several times in several places, like, that won't work. No, that community won't appreciate that. Or, you just have to know and be open to being told no. And I want to reiterate, when you hear no from a tribal community, a no is a no. And hassling somebody for this, like right now we're doing potential decliner studies on, why did you decline joining the study? And that's kind of inappropriate in a lot of our Pueblo communities, because when you were given this time to decide whether or not they wanted to participate, and it's a no, there's your answer. Take what you can from that, but don't be calling them up again, don't be hassling them for further surveys about it. It's when decisions like that are made, it's really hard to come back on things, because when we close out community meetings, culturally and traditionally, it's usually ended with like, that is our decision, that is how it is, and that's how we'll move forward. And so trying to come back on these things is really hard for, that whole spiritual well-being on things. And so I think that you really need somebody there that will help you, point you guys out, move you guys, and help you, navigate, because every community is different. What works in Quetawki will not work in Laguna. What works in Zuni will definitely not work in San Felipe. So we have to really, yeah.
So, Mallery, thank you so much. I have a question. So yeah, I heard you say no, and I feel, as a collaborator, right, as a partner, I feel it's very important. And I also been on groups where people didn't say no, right? Like, and maybe really everything was great, but maybe not, right? So what would you suggest for this sort of situation?
I feel like when sometimes, so this is my struggle here at UNM, everything's so siloed. I've been wanting guidance in a lot of issues, because I too need mentorship. I too want to look up to some of my colleagues who are, professionals, who are providers, or, investigators. And sometimes what I notice is when things just aren't working out, like how else do we leverage, the community's needs and wants if it's not being heard? Or, like I said, if we say no and it still goes on, the key thing you'll see is you'll start seeing all the Native people drop from the program, left and right. That's your key red flag right there. But I've been hoping that UNM can build some kind of an advisory council or a mediator group that helps us navigate through these communities and through decisions we make here before we take to IRB. Because IRB, there's only one Indigenous person that sits on that board who cannot really speak for everyone. They're there and they help approve UNM research studies. But in order for us to be, a little more comfortable moving to tribal council, why not we have an internal advisory board? That's something that we're actually looking into, so that we can go and get advice on how to move forward. And fortunately with we have a lawyer that represents the community. So having tribal advisory committees is also a big thing, and in your research groups, you really have to build that panel based off on the community, also based off on the cultural leaders, tribal leaders, and people who have the expertise in the area that you're researching, like from these communities, because they will help guide you. Right now, there is, a lot of, there's people here within UNM that will, we're trying to, I guess you can say, organize to come to a center where anyone who has these kinds of questions can just come to this one place, seen as one. But we also need to meet with our folks at South Campus, Native American Studies, the Center for Indigenous Planning and Design, American Indian Student Services, everyone that works together, all the policies makers who run the Native Policy Institute here at UNM, all those people should be in concert together to help guide all the research and events that happen here at UNM. That's something we're trying to build. But in a perfect world, that's who I would go to if things are, not moving the way they should for our community.